Okay, so this is chapter 6, dimensional analysis. And like I said, this is a method that we use to convert, to be able to convert and do the medication dosage calculations for pretty much all of the medications. And this is what we use also for the nursing program and everywhere else. This is what you will have to like really tackle down the dimensional analysis. So we are going to be doing conversion, you know, utilizing that conversion table that I mentioned to you guys. We need to get that by memory. We need to memorize that conversion table so that we are able to convert the unit of measurements into what we are being asked to give. For example, if the doctor's telling us to give so many milligrams and we have our dosage strength, it comes in tablets or it comes in liquid, we have to figure out utilizing this method and how many tablets are we going to give or how many mLs do we have to administer to our patient. So we do a lot of solving utilizing this method. Okay, so the conversion factors, that is why it's very important that you memorize that, because every time that we get a problem and we're given different a different dosage strength, or we're given a different the supply, you know, depending on what they give us as a supply, we have to convert it. Another example is like if we get something in milligrams and mLs, we have to also convert it so that we can explain the patient how many teaspoons, you know, utilizing the household system. So there's plenty of ways that we're gonna go over. So you see the conversion factors could include the standard equivalent of measurement, such as this. Like we should know by now that 1 gram, it's equal to 1,000 milligrams, and also that the dosage strength of a medication will always be the strength of the medication itself, plus the form. You know, what is it, how does it come into? Is it in liquid? Is it in tablets? Is it in capsules? Or units, you know, depending what it is. So the form of the medication. So in order to work the dimensional analysis, we need to have these two. We need to have for sure the standard equivalent measurement, and we need to have the dosage strength. So you will need this two for every problem that you do, okay? So other information that you need is besides what I just said, the dosage strength and the desired dose, pretty much those two. And then we have the unknown, like what is it that we're trying to give? Just to bring up an example, the doctor could give, like I said, the doctor can say, give 100 milligrams of such medication. So I have to figure out how many mLs is it gonna be, or how many tablets, how am I going to administer? So that the unknown, that's how we call it, the unknown amount, it's going to be represented by an X, okay? So we need the dosage strength, we need the desired dose, which is the doctor's order, and the X, which is the unknown, what's gonna be our, once we solve it, okay? So those three you need for every problem, okay? So let's talk a little bit more about the dosage strength. That is normally found in the medication itself. So you will always find that in the medication. And we talked about this last week. This is Acupril, this label that you guys see right there. It's a blood pressure medication. The strength is 5 milligrams, and the form, it's in tablets, okay? So the unit of measurement, and then the form of it. So will be, in this case, a tablet, okay? So that's basically your dosage strength. It's composed of 2 parts, the strength and then the form of the medication, okay? This is another example of a dosage strength, and this is on a vial. For example, here, this medication, Mesna, I'm sorry. It comes in 1 gram in 10 mLs. So this is the form, the milliliters, and then the strength is 1 gram, okay? So let's put that into an actual problem. So like I said, when we do the conversion, when we do the setup, the dosage strength, it's going to be expressed like this, just like you see it right here. The form goes on top, and then the strength of the medication will go on the bottom. So this is something that, you know, we have to memorize this, that this is the way it would always go. The form, so tablets, right? Tablets will be on top, and the strength will be in the bottom. Okay, so this is the example of the Acupril, the blood pressure medication, that it comes in tablets. So this is how it would be expressed. And then the other medication, the Mesna, 1 gram, the strength goes in the bottom, and then it's in 10 mLs. Okay, so now let's talk about the steps to solve this. When we set up have any of you guys done dimensional analysis? I know we have a couple of LVNs already in the program, in the class, I'm sorry, but have you guys ever been introduced to dimensional analysis before?
Yes, in chemistry.
Okay, already. Okay, only that it's, you know, it starts to make sense now that we use other stuff and we apply it to medication. So it's different. I mean, it's the same process, just that we are adding, you know, more like information and actually scenario cases. So we talked about the dosage strength right here, and now we need the doctor's order. So normally the doctor's order will be the other component of the setup. So normally for the order amount or the doctor's order, you're going to put a 1, you can put an imaginary 1 as a denominator. The denominator is the number, you know, that will be in the bottom. And I'll show you right now the next slide. So you're gonna write down the desired amount, also known as the unknown, and then we're gonna put it in a conversion. So let me just show you here so that it can make more sense. So we have this order here that says the physician orders a medication, M 10 milligrams, PO daily, by mouth daily per oral. The pharmacy supplies medication M with the dosage strength of 5 milligrams per tablet. And the question says, how many tablets should the nurse administer? So first of all, write the order amount. So the doctor ordered 10 milligrams, right? That will be the desired amount. So the X is going to be the unknown, what we need to figure out. And when we put it on the conversion, when we set it up, you're gonna put the doctor's order first. And I suggest that you always do this, that you put the doctor's orders first and then the dosage strength. So this is where it said that you could put the 1, you know, in the bottom. So we don't put it, I mean, as I go, you become used to it. But this is the doctor's order, and this is the dosage strength. And this is the unknown. What is it that we're trying to figure out? Which is also what you will find that out on your question. What is it asking you? Like what is the problem asking you? So once you do this setup, you're going to solve. First of all, we're going to cancel the units, the same units. In this case, the unit of measurement, it's milligrams and milligrams. We're gonna cancel those out, and then we have tablets left. So you're supposed to be left with just the specific form of medication that you're looking for. In this case, tablets. So you have tablets, so that's what I'm looking for. And then you're going to solve the problem by multiplying the numerators. So you're gonna multiply the numbers on the top, 10 times 1, right? Is gonna be equals to 10. And then in the bottom, we only have 5. But if you had another number, you would multiply it. In this case, if it was the 1, you know, 1 times 5, it would have been, it would be 5. So you're left with 10 divided by 5. It's equal to 2, right? So it will be 2 tablets. This is the answer for your problem. Okay, let's work on one. How are you guys, do you guys more or less get it? And I personally like to always put the unknown first. For example, it's saying how many tablets. So I like to start off with I like to start off by always putting what I'm looking for. That way I don't forget. So I put tablet and then I start working my problem. You know, like, oops, milligrams times 1 tab. And then the 5 milligrams. That way I don't forget that what I'm looking for is tablets. So let's do one problem together. Let's see. This problem says, can somebody help me read it?
I can read it. I apologize for my voice. I'm still a little hoarse.
Okay, thank you.
The nurse is to administer 187.5 micrograms of Lanoxin orally daily. How many tablets will the nurse give to the patient daily?
Okay, so what am I looking for, first of all? What's my my unknown?
How many tablets?
The tablets, right? So first of all, I mean, you can, like I said, I like this is like my X. I'm looking for tablets. So, and then what you wanna do next is write down the order, the doctor's order. And this is in mcgs, this is micrograms. And then what's my next component? I have two so far. I have the desired amount. I have the order, the desired amount, the unknown, right? What I want to do, the desired amount, and I need my dosage strength. So what would my dosage strength be?
125 micrograms.
So, and here, if you can see, this is a label that sometimes they give you two different ones because sometimes the doctor gives you the order in milligrams. So this is, you know, you remember, we're gonna pick the one that's more convenient, the one that it's gonna make us work less. So in this case, I'm going to get the 125, and remember that the dosage, the strength goes in the bottom and the form of the medication goes in the top. Right? So the next step to follow is to cancel the units of measurement. So I'm going to cancel the micrograms and micrograms, and I'm going to be left alone with this, what I'm looking for, my unknown, right? So I need to solve for that. So, right, as you can see here, my next step is to multiply. My next step is to multiply the numerators. So I'm gonna multiply 187.5 by times 1, which is gonna be 187.5. And in the bottom is gonna be 125. So I have to do my math. That's why the division and multiplications and all that stuff, it's so important, because now we need to work out a math problem there. And if you're already getting ahead of me, that's great. That way you can start giving us some answers there. So I'm going to go 125. This goes one time into 187. And then my decimal goes up and then here. So just by looking at this, I think it's gonna be 5 times. The 125 is gonna go into 625. Let's try a 5. So for those of you that don't remember, the 5 times 5, 25. I got 2, 10, 12. I got 1, 5, and 6. So yeah, I did it exactly. 1.5. It's my answer, right? So being realistic, do we want to write 1.5 tablets? What's the other way of writing this down? Would it make more sense if you write down 1.5 tablets?
Yes.
It does, right? So 1.5 tablet, that's actually what I'm looking for. That you tell me, oh yes, 1.5 tablets. Because, I mean, not 1.5. 1.5 will be more like for liquid. So 1.5 tablets, that would be your answer for this problem. Do you have any questions on this? This is like the basic dimensional analysis calculations.
I have a question. Is this one of those instances where you would not write 1.5 because it can be mistaken for 15?
Correct. You can make a big mistake just by doing that. Yes. And in the nursing program, I will tell you as well, if a student gives an answer 1.5, we mark it wrong. We mark it wrong because we want to make sure that they understand that, you know, and also we want to be realistic. It's going to be 1.5 tablet. And then you don't want to make that that mistake that the decimal is not seen, and then it turns into 15. So it can be a big medication error right there. So let's go to the next slide. So that was like the basic, you know, like the basic of solving. The interesting part is when we start adding, you know, other, or we have to convert other units of measurement along with, you know, the problem itself. Like I said, sometimes we have to, we have to go to look for teaspoons, and the doctor orders, you know, they give us a weird, like a 50 milligram order, and our dosage strength comes in mLs. And we also have to turn it into teaspoon, you know, for the patient so that we can instruct on how to take the medication. So we have different types of unit of measurement that we have to utilize this conversion table to also and plot it into the problem itself. So we use the metric system. You know, sometimes once you guys get the metric system, it gets so easier because you just move your numbers, you know, to the left and to the right. And but sometimes we have dosage calculations that yes, you do use the metric system, but on top of that, we have to add, like I said, the household system. So that's when it gets a little bit more interesting. So we learned about the metric system last week and how to use the metric line. And it will save you a ton of time when you use the metric line. So let's work on a problem in which we have to utilize or add a conversion unit of measurement as well. So this particular example here, it says the prescriber orders 750 milligrams of a medication. The dosage strength is 500 milligrams per 10 mLs. And the question says, how many teaspoons will the nurse give? So now we're looking for teaspoons. So in solving this problem, you know, utilizing the DA, I'm just gonna call it DA, so a really long name. The dosage strength, so remember the different components, the dosage strength, the conversion factor, and then we have to put what we have on hand, our supply. So if you see here, we have the order amount or doctor's order, the dosage strength is here, which is here. The dosage strength is 500 milligrams per 10 mLs. So we have that as our second component. And then we have, because the question is asking us how many teaspoons would the nurse give? So if I just use this 2, right, and solve for X, I'm going to get an answer in milliliters. So, but my answer should not be milliliters. My answer should be teaspoons. So you want to add from your conversion table or your conversion factor what it's equivalent to. So remember the 5 mLs, right? It's equal to 1 teaspoon, right? 5 mLs, 1 teaspoon. So we have to plot it in our setup here so that we can be left off with teaspoons only, okay? So what I do with the cancellation, milligrams and milligrams, and then mLs and mLs, and then I am left off with the teaspoons, okay? So, and then you solve for X, following the same process, you're gonna multiply the 750 times 10, and then times the 1, and the same thing for the bottom, the 500 times 5, which is equal to 2,500. And when I multiply this 3, it was 7,500. So I like to get rid of the zeros. 75 divided by 25 is equal to 3. So it's equal to 3 teaspoons. So now I have the right answer, you know, to what is my question is actually asking me. Same thing here, when sometimes we get a 15 ml as an answer, but that's not what the question is asking us. The question is asking us 4 teaspoons. So that's why I need you to really memorize that conversion table, because you're gonna do a lot of conversions. Let's work on a problem.
I have a quick question.
Uh-huh.
The household chart that we saw a few slides ago, is that as extensive as it gets? That's it? It's not, there's not more to it?
There is, for the household,
yes,
pretty much that's it. It's, yeah, pretty much is what we use at the house, which is going to be the teaspoon, the tablespoon, the cup. What else? Or the cup, you know, the ice, sometimes the ice. And I'll tell you how we do the ice. It's normally half of the actual cup. It turns into half. That's pretty much it. You know, like because that's all that we do. And then we'll talk about injections, because there's insulin as well. But yeah, that's pretty much it. And I think I have another slide here. Oh no, it was that one. You're talking about this one?
Yes.
That's pretty much the household system. Mm-hmm.
Okay, thank you.
It's what we use at home, you know, what we can come up with, you know, like typically to take medications. So let's work in this problem. It says the prescriber orders 125 micrograms, mcgs, of bumetadine, direct IV. So, so you know, bumetadine, it's a very strong diuretic. So usually the dosages for bumetadine, they're really, really small because it's very aggressive. So the pharmacy sends, and a diuretic, it's a water, like a water medication. It takes out the water, the excess water from the body. So we have to give it carefully, because if you lose too much water too fast, too soon, your blood pressure drops and it becomes like a big old disequilibrium in the body. So the pharmacy sends the following vial. And the question says, how many milliliters would the nurse give? Okay, so I am looking for mLs. What is the next component? The doctor's order, right? The doctor's, the order medication is 125 mcgs. And then what follows is going to be my dosage, my dosage strength. So I would like to use either way. Either way is going to come up with the, which one would you use, the 100, the 1 milligram per 4 mLs, or would you use the 0.25 milligrams per 1 ml?
The 1 ml.
You want to use the 1 ml?
Yeah.
Either way, it's going to take us there. Watch. Actually, I'm going to use the smaller one, actually, because I am not giving 1 milligram. It's 1,000 mcgs. In my conversion table, 1 milligram is 1,000 mcgs. So if I use the 1 ml, my problem is going to be bigger. So I can just go ahead and select the 0.25 so that I can, you know, it doesn't have to be as big. So the strength goes in the bottom and the unit of measurement would be on top. So it's 0.25. Oh, it's an ugly one. Okay. What else do I need in that problem? Can I cancel out? Can I cancel out any units?
No.
No, right? So that's what I need. I need to plug in my conversion factor here. So like I said, and it has to be opposite. If the milligram is in the bottom here, then I have to have milligram on the top. And then how many mcgs did I said? It's 1,000 mcgs. So now can I cancel? Can I cancel out stuff?
Yes.
Yes, right? So I'm gonna cancel mcgs with mcgs, milligrams with milligrams, and I am left with mLs, which is exactly what I'm looking for, right? So now I'm going to multiply the 125 times 1 times 1, and then the 0.25 times 1,000. So 125 times 1 times 1 plus is 125, right? And then if I multiply 1,000 times 0.25, that's a lot of zeros. 1, 2, 3, 2. And then I got this here. 1, 2, 3, 4. It's 20.5, and then the was my discussion post this week about the why we don't use calculators, or no? Wasn't it? Okay. Okay, so it's 250, and this is just like a little trick that I have normally, that I use a lot to make sure that my multiplication is correct. I normally do like an X, and I add the numbers that I add this number, so it's only a 1, and then I add this number, so it's 7. So 2 plus 5, 7, and then I multiply them. 1 times 7 is 7, and then whatever numbers you have in the bottom, if you add them, like 2 plus 5 is 7. So if these two match, then my multiplication is correct. So I have 250 in the bottom. So if we divide 125 by 250, it's gonna be 0.5, but I'm just gonna. Do it so you can see. So 125 divided by 250. So it doesn't fit. So I'm gonna do 5. Okay, so in this, my answer is 0.5 mLs. Okay, so 0.5 milliliters. And that is, you know, that's pretty, like I said, when we give this medication, it's pretty strong. We have to be monitoring the patient because it drops their blood pressure quite fast, depending. So that's the answer, okay? Any questions? So we're going to, that's the dimensional analysis. What I'm gonna do now is I'm going to get into the other chapter. The next chapter is oral medications. So it's more dimensional analysis, but we're gonna talk about oral medications. And we're gonna work on some problems there.
Miss Bravo, this week's discussion is not about the calculators.
It wasn't, it's about, that's gonna be next week's.
Yeah, so why we need med math.
Yes. I'm sorry, it was like 4 o'clock in the morning. I was like coming up with my.
Oh, that's okay.
Thank you for reading. So, okay, you guys can see the next chapter. Let me know. Okay, so you guys see the types of oral meds, right? Do you guys? Or you?
Yeah. Is this chapter 7 or 8?
Chapter 8. Chapter 8. And I'll tell you, once you get the dimensional analysis going, it's, you know, it will be easier. But later we're gonna work with drops and some other stuff, and the time goes quite fast. So okay, so let's talk about calculating oral medications first, and then we'll talk about injectables next. So there are different types of oral medications. We have discussed already that there are, you know, the solid type of medications, which we're talking about the tablets. And tablets, there is two ways, you know, the regular tablet, or they could be scored. When you hear the word scored, is those tablets that have a line, they have a line in the center, and that means that they can be cut in half. You know, they can be cut in half. And we have to be careful, because if it does not say score in the label, then we could be breaking, you know, the coating that the tablet could have by, you know, by cutting the tablet in half, which could be harmful. Or what would happen is that it would dissolve before going into the place that it needs to go. Like sometimes by the time that they get to the stomach and by the time they start dissolving, the tablet is actually built, you know, it's fabricated so that it does its job with digestion and things like that. So we have to be careful that we don't cut a tablet, or we don't give instructions to somebody to cut a tablet that is not scored. There are also capsules, and the capsules, you guys have seen them inside. They have tiny little beads or little pellets that they dissolve over time. Those, the same thing. A capsule, when it's ingested, it's meant to go to the stomach and then be, you know, digested, so that then the little beads or pellets, they start, you know, doing it with their work and start dissolving. They're meant to be dissolved and released over time, not right away. So I have seen people that they open those capsules and they put them in water, and they, you know, and then they take them. They're not meant to be taken like that, because then they start, you know, they start working, and they could hurt. They could actually be harmful for the esophagus and other. The stomach and the acids of the stomach are really strong, and they can take it. But we have to be, you know, specifically careful with that. And then we have liquid form. We have elixirs, we have syrups, and we have suspensions. The difference in between these two is that elixirs, they have alcohol. They have a little bit of alcohol. And this is something, sometimes this is something that we don't pay much attention sometimes, but when you have an elixir, it's got a little bit of alcohol to mix up the medication. If we have syrup, I don't know, you guys have seen, the syrup is really viscous, very thick, and very sweet. So it's like they mix up the medication there. And you can see the medication, like the little bolitas, you know, like the little undissolved bits also as well, or pellets, that they're in the viscosity of the medication. And then we have the suspensions. Suspensions are medications that are also liquid, but they're mixed up in water. So we have to mix them up in water. And one example is that azithromycin that they give us, and we have to prepare at home. Back when I was a kid, my mom used to boil water and stuff like that to add and mix up the medication and then make it up. So that's, you know, that will be the suspension. And then we have powder, like that also need to be reconstituted, and they're mixed with liquid as well. And the pharmacies, it's pretty similar to what I'm telling you, that you add the water. The pharmacies now, they mix it up for us. But this is something that we used to do. And when you guys are nurses, you're gonna be doing this reconstitution as well. Now let's talk about the different measurement devices that we have. We have the typical medicine cap that we get. The medicine cap has got the calibration there, so you can see in ounces and in milliliters. So, and it's also marked in a household unit, so you can see if it's 1 teaspoon, 2 teaspoons. I'm sure you guys have seen this. The oral syringe, if you have a kid, they might give you the medication, and then they give you the syringe as well, so that you can administer the medication easier. And then we have the cylindrical dosing spoon. This is like a spoon that they also give you at the pharmacy, and the spoon has the calibration also marked in the spoon, so that you can give it to the baby or And one that is not here, you guys, that I do and I use a lot is, I use the nipple on babies. I use the bottle, the nipple, and I get it with a syringe and put it in the nipple, and the babies just suck the medication quickly. So that's a really good one. So let's, and then we also have the calibrated dropper, you know, when it has to be, the medication has to be given in drops. So you have the, I lost my presentation. Okay, then you have the little dropper. Okay, so you have to do it by drops. And usually a dropper is 1 ml. They're not that big. So this is something that we use on babies again. Okay, so those are the different ways that we would administer the medication. And the same thing, you know, when we are calculating an oral medication and the dosage, we have to consider what is it that's being ordered, the route, right? The route is, in this case, is, you know, it will be oral. And then the frequency. The frequency, for those of you that haven't taken med term or medical terminology, this means every morning, okay? So the prescriber orders aldactone, that's a blood pressure medication, 50 milligrams orally every morning. And it's asking how many tablets should the nurse administer. So every single calculation will begin like that, with the doctor's order and what is on the label. So let's see here, calculating the oral dosage. So you see, again, this is how the doctor is gonna write it down in the patient's medical record. So there's the order, and this is what the label will look like, okay? So aldactone, spironolactone, that's a sparing potassium. That's another diuretic, is to get, well, I mean, it works for blood pressure, but it's also diuretic. So let's quickly and briefly go over the different methods of calculation that I told you about. So and with this same information, okay, this same information, I'm just gonna tell you how to, normally we do it with the other methods. We have the linear, ratio, and proportion. So to calculate the right dose, we can set up the problem utilizing the linear method. So again, this is the order, and this is what I have my supply, and this is what it says in the dosage strength, 25 milligrams per tablet. So the linear, and the word itself, it says linear and proportion. So the linear, you're gonna write what you know on one side and what you don't know in the other side. So what you do know is the dosage strength, which is 25 milligrams per tablet. And what you don't know is how many tablets are you gonna give in 50 milligrams, which is the doctor's order. So basically what the linear ratio, what you do is that, oh, my pen here. What you do is that you multiply the outside numbers, the 25 times the X, and it's 25X, and then you multiply the inner numbers. So the 1 times 50, which is here, and then you solve for X. Divided by 25 is 1, and then 50, so it's equal to 2. That's one of the methods that we use. And then we have the fractional, ration, and proportion. So it's the same order, 50 milligrams, and then what I have sent by the pharmacy. And we haven't color coded so that we see that it's different. So normally the setup is pretty similar, the known and the unknown. So, but the setup goes in fractional ratio. So and you set it up like 25 milligrams in one tablet, and then the unknown. And if you notice that they're both, you know, milligrams, they're in the same. So what you're gonna do is cross multiply. In this one, you cross multiply. So 25 times X, and then the 50 times 1. So it's 50, and then you solve for X, which is gonna leave you in two tablets as well, okay? And then of course we have the dimensional analysis, the one that we're using right now, the order, pharmacy send, and then the setup is going to be just kind of like I told you, we're looking for tablets. So your desired, I mean the order, the doctor's order, and then you're gonna put the strength of the medication and the form that it comes, tablets. And then you cancel out, you're left with tablets. 50 times 150, 25 is equal to 2. Okay. And there is another method that we use, which is the formula method. And this, I'll just show you, this is the order, the supply. And when we set it up milligrams and milligrams, we set them up and then the tablet, which is what I'm looking for. And all you do is divide it, and then you divide it and then multiply, which is gonna be equals to 2. I just wanted to like briefly tell you about them, but we are sticking to dimensional analysis only. There's no point that I have you guys do homework on the other ones when you guys don't need to really learn them. But at least you won't say, she never told us about them. I mean, I just introduced you to them. So let's, knowing what I've told you about dimensional analysis, can you guys work on this problem? Or do you guys still need me to work it out? Or can you guys try it by yourself? What should I put first? What should I do first right now?
The order amount.
Okay, I'm looking for tablets. And my order amount is 7.5 milligrams. And what is my dosage strength?
2.5 milligrams.
Per tablet. So, okay. So I'm gonna cancel, tablet. 7.5 times 1, that's 7.5. And in the bottom, I had the 2.5, right? So once we divide this 2, what am I gonna be left with? So I have decimals, so I'm gonna go 1, 1. So 25 and 75, how many times? 3.
3 times.
3 times. So my right answer here, how many tablets will the nurse give to the patient? 3 tablets. Or 3 tabs, okay? And warfarin, it's a medication that it's another high risk medication. It's a very strong anticoagulant. And we normally give doses like this, kind of weird like this, like 7.5 or 2.5 or things like that. And we have to figure out the amount of tablets. Okay. Let's do this other problem. This is albuterol sulfate. This is a bronchodilator. Those of you that have asthma or have kids, we use this medication a lot. So the prescriber orders albuterol sulfate syrup. Oh, and they're used to have, well, we still use it. Dr. Kapoor still orders syrup. 3 milligrams orally every morning. So how many milliliters will the nurse give to the patient? So it's the same process, the same setup, only that we are now looking for milliliters. Okay, so my order is 3 milligrams. And what goes in the bottom, you guys? This is my dosage strength. What should be in the bottom? If I do my
2 milligrams.
The 2 milligrams, right? It always has to be opposite. So and then this is the strength. That's another way of looking at it. The strength and the form of the medication, it's in liquid. So that way we can cancel out. Every time we cancel out, they have to be opposite. Milligram, milligram, and then I'm left with mLs, which I know I'm okay because this is exactly what I'm looking for, mLs. When I multiply 3 times 5, it's going to be 15, and then the 2. So now when I divide 15 by 2, it's gonna be 7. So 7 times 2 is 14. I got 1, and then I got the 0, which is gonna be 5. So 7.5 milliliters is the answer. Or, you write down per dose. That will be my dose. Okay. Do I still have you with me, or did I lose you? Are you guys okay? So like I said, sometimes we have to calculate, do this setup and do the calculations. So as we get the doctor's order and then we get the pharmacy supplied and we have to do a calculation already, you know, there. And then we have to add more to our calculation because we have to convert it into something that the patient would understand. So we can tell the patient how many tablespoons or how many ounces or how many teaspoons. So that's when we do that. And like I told you, you can save a lot of time by utilizing the metric line when you are converting things, you know, from, you know, to convert it into multiply it or divide it. So that's where the metric system comes in handy. More of those household equivalents. So like I said, when you get any of this, you know, how we are gonna administer, we have to add this into the conversion. So we add them, we will add them into our setup as well. So there are other calculations that we have to also add more, you know, from the conversion table, such as grams and milligrams or mcgs. For example, here it says, this is the order. The order is cefuroxime oral suspension, and they're ordering 0.5 gram. That's the order. And the pharmacy is sending me 250 milligrams in 5 mLs. But the question is saying, how many teaspoons would the patient take? So you have to add, you know, all of this into that one setup, you know, into that one setup that I told you, which would be, let me see if this is the what was ordered, right? That's what it was ordered. And then right here, you have the dosage strength, and then you have, I had to add from the conversion table, I had to put my 1 teaspoon equals to 5 mLs. And also to be able to get rid of the gram, I have to add my conversion factor for milligrams so that I can convert it into milligrams, okay? And that's a way to set it up, and that's how the program in the book, you know, tells us to do it. And you will see that a lot of people do it, not the opposite, but I mean, I see it more clear when I write it down like this. I'm looking for teaspoons. This is my order, my gram, and then I put the dosage strength. And remember, that's the strength of the medication. And then it comes in mLs. And then once I have done those 3 components, remember the unknown, what was ordered, and then my dosage strength, right? My dosage strength. Once I have added those 3, then I know what else do I need to do to be able to do my cancellation. So I know at this point that I need to break down the gram. So I have to put the 1 gram, it's equal to 1,000 mcgs. And still, you know, like if I cancel gram and gram, I have mcgs, my milligrams, I'm sorry. And then I cancel milligrams and milligrams. Still, this is not what I need. I don't need mLs. What I need is teaspoon. So now I need to use my conversion factor so that I can turn it into teaspoons. Now I can cancel mLs, and this is what I'm looking for. Okay, so I like to see it that way. You can adopt either way, but I like to do my 3 components first. And then I add, you know, from my conversion table, if I need any conversion factors to break down to cancel out, and then be left on with what I need. And then you will multiply all of the top numbers. You will multiply them all, and then you will divide them by the 250 by times 5, which is 200 It's gonna be 1250. So anyways, that's the setup, and it's the same there. I mean, the way to arrange it, I think, is what you probably, what I meant, that it's easier if you do it that way. So let's work on this problem, you guys. Does anybody wanna or have access to, or you wanna, do you wanna work it out for the class, or tell me what to do and I'll write it down? No?
Well, first you write the ordered amount and it's gonna be in tablets. So,
okay. So tablets, and the order is
0.5 grams.
mm-hmm.
And then you write the dosage strength, which is 250 milligrams.
So what goes in the bottom?
The 250 milligrams. And the one on top.
Mm-hmm. And
then you have to write the conversion factor.
Mm-hmm. So where does gram goes?
Gram goes on top. So 1 gram.
They should be opposite.
Oh, I'm sorry, on the bottom.
Mm-hmm. And on top, how many milligrams is 1 gram?
Mm-hmm.
Okay. So 1,000 milligrams. Can I cancel out now?
Yes, the grams and the milligrams.
Okay. Then?
And then you multiply 0.5 times 1,000.
Times 1, and then 1,000, which is going to be, I think it's going to be 500, right? Because if I multiply 1,000 by 0.5.
Yes.
Yeah. And then in the bottom?
250.
So 50 divided by 25. Okay. Very good. Very good. Okay. Any questions?
So sometimes, oh.
Go ahead.
Sometimes you'll have to convert twice.
Yes. Sometimes you have to put like 2 or 3 conversion factors into the problem to get what you need to, or what it's asking you to give. So it depends. But yeah, sometimes you get, most of the time it's 1 or 2 that you have to utilize to convert. And that household system, we end up, adding the household system sometimes. But the good thing is that you can work it all out in the same problem.
Mm-hmm.
I have 2 more problems here to go over. You guys want me to go over them, or you guys feel? Let's do it
over them.
Yeah, let's do them. So right here, it says the order is for vibromycin, that's an antibiotic, and it's a suspension, 75 milligrams by mouth, BID, which means twice a day. How many tablespoons will the nurse give the patient? So we're not talking about teaspoons, we're talking about tablespoons. Okay, so how many mLs is there in a tablespoon?
15.
15, very good. Okay, so we're looking for tablespoons. My order says 75 milligrams. My dosage strength is here. So it's 25 milligrams and then 5 mLs. I always say also like mLs always go on top unless it's drops, but mLs would always start on top. So, so that's my dosage strength. And now it's asking me about tablespoons. So if it was asking me for mLs, that's it. That's as far as I would go. And then I will cancel out. But I need to do tablespoons. So and then I want to do tablespoons. So once I cancel mLs and mLs and then tablespoons. And now I'm going to multiply 75 times 50 times 5, I'm sorry. So 375 and then 25 times 15. So this one's an easy one, huh? It's an easy one. So 375 by 375 is equal to 1. So 1 tablespoon per dose. So that's my answer. All right. Let's do this one. Oh, no, it's not a problem. Let me just tell you about the reconstitution of powder medications. So powder medications, like I said, sometimes you're going to get medications that they come in powder because once you reconstitute them, they're spam, they're not going to last that long. And normally once you reconstitute a medication, it's not good like 7 to 14 days. It ranges from there to there. So which is most of the time is going to be antibiotics. Okay, once you reconstitute them, you have to read in the back and it says once reconstituted, discard after 7 to 10 days or discard after 14 days or whatever, you know, whatever it's specifically telling you. So if you, I don't know if you're able to see, those are super tiny letters, but it says you have the Ceftine oral suspension for oral use only, and then you have your dosage strength, and then it says here that once you reconstitute, it's going to come up with to 50 mLs. And your instructions say to add 19 mLs of water to reconstitute, and then replace the cap. It's telling you, you know, to shake it vigorously and every time before administering. And then it says how you have to store it after it's been reconstituted. It says the temperature that you need to keep it. And I'm trying to read for how long is it good for. Normally,
on the bottom it says discard after 10 days.
Ah, there it is. Okay, sorry. It's tiny letters. Okay, so it gives you all of those instructions. I mean, besides looking at the expiration date, right? You see the expiration date, but also once it's reconstituted, it's not, normally it's not good after 10 or 14 days, okay? So it gives you the instructions, but you have to add the 19 mLs of water to reconstitute it. So whatever it says according to the instructions, it will tell you then the dosage strength will be this after reconstitution. Okay, so your calculation is going to be based on this, you know, also. Okay, so let's see this very last problem. It says the physician orders amoxicillin suspension 0.25 grams orally twice a day, BID. How many teaspoons will the nurse give the patient? So again, we have the amoxicillin powder and it tells you the dosage strength. It's telling me how many mLs would it be after reconstitution. And sideways, it says to add total approximately. Oh, you guys have better eyes than me.
100.
Anyway, go ahead.
Oh, 110 milliliters.
Oh, there we go. Okay. And then it says, you know, it gives you all of the other instructions that follow, but your dosage strength, it's still this, right? So let's work this out to see how many teaspoons would we give the patient, okay? So I need teaspoons. My order says to 0.25 grams. And once you get to know once you guys get to know the conversion table by memory, you will know that 0.25 grams is actually how many milligrams? 250. 250 milligrams. So normally, but we have to, you know, we have to practice the setup here. So hold on. And then my dosage strength, which I have 250, 5 mLs, and I have to be able to cancel out, I have to convert that gram into milligrams. And then I have to also add a conversion factor for the teaspoon. So it's going to be 1 teaspoon per 5 mLs. Now I'm good to cancel grams and grams, milligrams and milligrams, mLs and mLs, and I'm left with the teaspoon. So once I do this, it's going to be 1.25 times 1,000. I think it's 125. So I ran out of space, hold on. And I'm doing the whole setup, that way you guys can see. If you're doing it there, help me out, okay? Because I ran out of space here, a little easy. First, 125 times 1,000. Okay. Okay. And in the bottom, I have 250 times 1 times 5, which is exactly, it's exactly 1250. So that divided is going to be 1 teaspoon. I skipped a few steps, you guys, because I just multiplied the 250 by 1 by 5, which is going to be 1250. And then once I divide them, once I divide the 1250, it's 1 teaspoon. That will be my answer. Okay. Any questions on oral calculations? I guess we are following. Are we? Stephanie, you feel okay? Anna, who else do I have? I have
Yes.
7 people here. Okay. Hannah, Joel, that's my son's name. Joel, I call him Joel. Already. So you guys need a 5-minute break, or do I just jump into the other syringes? You guys want to run to get coffee, water, or something?
Jump in.
Sounds good. Keep going. Thank you, Hannah. I love seeing your guys' videos because I have a face, you know, I have a picture of you guys now. I know nobody likes to make videos of themselves. I'm one. Okay, 1, 2, and then we have chapter 9. So chapter 9 is, I'm gonna talk about syringes and needles. Just wait for it to show. Okay, there it is. Okay, so just confirm that you're seeing the first slide of the chapter.
Yes.
Yeah.
Okay. It's not that long, you guys. It's not that long. We'll be done soon. Syringes and needles. This is another important and essential part of dosage calculation. There's a lot of stuff that we need to, like remember. But like I said, once it makes sense, it'll start becoming easy for you. First of all, for syringes and needle, of course, we want to know what is our syringe. I know you guys have seen syringes before, but the parts of the syringe itself, what is it? Everything, the plunger, the barrel, calibration lines, the needle hub, and the tip of the syringe as well. Okay, so make sure you remember that, the anatomy of the syringe. And it helps a lot because by knowing the type of syringe that we're dealing with, we know like the tiny little lines, sometimes they're different calibration, depending how much volume is there in one syringe. So that is one of the main reasons why. Okay, so to be able to measure medications, we have to be able to read this calibration lines, and the 0 would always be right the very first line, So this light right here, all it's telling you is not to get it confused, that the first line is not where you start counting. The first line is more like the start line. It's more like this, you're starting from here. The first calibration line will be the following, like, tiny. That's a 3 ml syringe. So the lines are really small. So just remember, the very first line you see, that's more like the 0, the start line, and then calibrating from there. Okay. So how do we read the calibration lines? It depends, like I said, it depends on what's the type of syringe that we have, and they're normally based on the volume. You will read, you see the plunger, this is the plunger, and you see the rubber area right here. So you are going to read from the proximal end of the plunger. So the proximal end is this one. The distal end would be a little bit more to the right. So this is the distal end. You don't want to start count, because if you see, there is a calibration line in between them both. So if you read by the distal, which means that's the furthest, then you will probably give more medication than what you're supposed to. So you always have to read by the proximal, okay? So that's where the end of the plunger would be. And then we have the different choices of syringes that we use. We use them 1 milliliter, 1 ml, and we call it TB, okay? The TB syringe, or the TB syringe. We have 3 ml syringes. We have the syringes that are 5 or 6, 10, 12, 20, 30, and 50 to 60. So it depends the intention, or what do you need the syringe for. And I'll tell you, if you're trying to, sometimes the syringes with less volume, they have more pressure than the ones with more volume, they have less pressure. So, we depending on what you're going to be using it for. The syringes that are anywhere from 20, 30, 50, or 60, that's that type of volume is when you're going to give we have patients that have tubes in their stomach and we want to feed them, we feed them through the G tubes or the gastrostomy tubes, and we have to give them like a can and after another can. So of course we're going to use the big syringe for that. Okay. Let's talk a little bit more about the 1 ml TV or TV syringe. So it's 1 ml. The anatomy, of course, is the same. The calibration, though, the calibration, look at, so it's 1 ml, and every of the lines, the first calibration lines, they're calibrated in hundreds and tenths, okay, of a milliliter. So you see the 100s, the small, tiny line, it's a 0.01 ml. That's what it is. Okay. And the other calibration is that 0.1. So the whole 1 ml is divided in 10 of 0.1 mLs. So 0.1, 0.2, 0.3, and so forth. And the tiny little lines, each one line, that's what it represents, 0.01 mLs. And you're probably wondering, who gets those tiny little doses? Like, it's crazy. It's crazy. But in pediatrics, we have little ones that they get steroids, for example, steroids, and they get, I don't know, just to throw a number, 0.067. So 0.006. So you would do 6 of these tiny little lines, the tiny little lines. Okay, newborn babies, we do use the TV syringe a lot for this type of medications because their dosages are so tiny that you're like, wow, that's crazy. So yes, that's the reason why. Okay, we have the 3 ml syringe. The 3 ml boy holds up to 3 mLs, and then the calibration is in tenths of a milliliter. So this is 1 ml. So every line is 0.1. So every line is 0.1, kind of like this 0.1. So every single line is 0.1. This is half an ml, 0.6, and so forth, until, you know, the whole ml. Then we have the 5 and 6 milliliters. Their calibration of the 5 and 6 ml syringes, their calibrations is 2/10. So each one of the tiny little lines, it means 0.2 mLs, okay? And then we have the 10 and 12 ml syringes, their calibrations, also they're tiny, they're 0.2. So they're a little bit more standard. So they're also 0.2. And then we have a sample of the 20 and 30 ml syringes, and each line, each calibration line here, it's 1 ml. And what a difference, huh? It's we have going from 1 ml syringe to this 20 to 30 ml syringes. So every line means 1 ml, okay? You need to memorize those, the different calibration types, because I am going to put some questions on this. And then with the big syringes, another thing is that if you turn it to the other side, it's also gonna have a scale. So it's gonna tell you what it is in ounces. So a lot of the syringes, when you turn it, like right here on this side, is telling you an ounces, and then it tells you in mLs as well. All right, and then we have the big 50 to 60 syringes. So each tiny line, it's 1 ml, and then it goes in increments of 5, 5, 5, 5, 5. Okay, and then it also tells you about the ounces. So you guys tell me, the nurse, it's going to withdraw 0.9 milliliters of a medication. Which of those 2 syringes would you use?
A.
Mm-hmm. And if you don't have A, could you use B?
Yes.
You could, right? Yep. So that's correct. You could use either one in this particular case, because the small calibration lines here are in tenths as well. So it's 0.1. So very good. So let's do this other one. The nurse withdraws 0.25 milliliters of a medication. Which of these 2 syringes shows 0.25 milliliters of a medication?
A.
A.
A, right? Very good. Okay. So we're good so far. That's good. We just have a few more slides. So also another thing on syringes and needles is that we also need to learn about the needles. You know, like sometimes we, I mean, if we give a medication orally, that's awesome, right? But the whole purpose of the syringes is because they're going to be injected. So when we inject a medication, we need to be very aware of the length and the diameter of the gauge. Okay, and normally the length is how long is that needle, and normally the label of the needle will be in inches. It's not going to be in centimeters, it's going to be in inches. And then that diameter, that's how thick, or the gauge size of the needle. Okay, so the bigger the diameter, depending on the medications, if you have to give antibiotics, you don't want to use a small gauge because that's going to be real thick and it's going to clog the needle, and it's going to hurt too. So you want to use a bigger gauge number. So we have to be aware of those things. Also, depending on the person, if we have a baby, I'm not going to use a super long needle. There's some needles that are 2 inches long, like this big. So you don't want to give, you're going to go through that poor baby's arm, you know, like, or legs. So we have to be able to decide, and that is something that you as a provider, you will be able to determine depending on the various lengths, sizes, and gauge numbers. You will see, okay, I need this one. Or also, if depending the route, if you're gonna give the medication intradermal or subcutaneous or intramuscular, or if it's an IV. And as you see in the picture here, it tells you if the doctor writes down an order and says you're gonna give, I don't know if you guys have gotten the PPD, the skin test, the tuberculin, or also known as Mantoux test. If you get the PPD and they do a little bubble, right, a little wheel, that has to be an intradermal injection. So we need to use something really small because all we need to go is through the first layer of the skin. Usually intradermals, they go in between the dermis and the epidermis. So it's like right there. As soon we just cross the epidermis, that's it. And then we inject the medication, and that's why it gets this wheel. So there are some medications that are intradermal. Just to give you some examples, when you're gonna get tested for food allergies or environmental allergies, sometimes they do multiple little shots. You know, they give you they put you the different they expose you to different allergens. So they inject those in the person. Normally they do that in the back, and they do it intradermally. Another exam is the PPD, the tuberculosis exam, that they do it intradermal as well. They also do anesthetics intradermally. Sometimes when they have to give a medication, they do it intradermal, like as a topical anesthetic. So they do intradermal, okay? Then we have subcutaneous. Subcutaneous, it goes down the first 2 layers of the skin down to the subcutaneous tissue. So I needed something a little bit longer, you know, to go down the subcutaneous tissue. So that will be, for example, the heparin, an anticoagulant, we do it subcutaneously. People that get insulin, you know, that they have to give themselves insulin, they do it subcutaneously as well. So, and if you see here, guys, the angle is also different. Normally an intradermal, when we give an intradermal, it's anywhere from 10 to 15 grades, you know, like the elevation, the
Degrees?
Degrees. I don't know what, I'm having a little moment, foggy moment. So this 10 to 15 degrees, and then the subcutaneous, it's 45 up to 90 degrees. So if I have somebody that's a little bit bigger, I can just go 90 degrees. But if it's 45 to 90, and then if you see here, the intramusculars are always at a 90-degree angle, always at a 90-degree angle, because we're trying to get into the muscle. So there's adipose tissue. So we have to go all of these layers down to the muscle. So yes, I need something longer. And then the intravenous. So in order to get down to the vein, I'm sorry, we have to go deeper as well. And the angle to go to the vein, it could go anywhere from 30s all the way to we have a machine in the hospital that tells us. So sometimes we go at a 90-degree angle to find a vein, but it's normally goes, 45-degree angle for veins to get a vein. So as you can see, they're all different lengths. They're all different lengths depending on the purpose of the medication. So you have this chart here that you have to know it by heart. You have to like understand it. This little needle here, it's 5/16 of an inch, and normally they can be used for subcutaneous. We use 1/2 inch a lot, and the 3/4. 3/4 is intradermals. Then they're not so long. You just need to go through the first layer. That's it. So they're 3/4 of an inch. Then we have the 1/2 inch for subcutaneous and intradermal as well. And then the 5/8 subcutaneous and so forth. So you can see we have patients that are pretty big and they need a deep they need a deep intramuscular, and we get those 2 inches, like they look like the turkey. I always call it the el pavo. If they look so long and so and thick as well. So when I said gauge, this is where the gauge is. Well, this is called the bevel. Whenever we give an injection, the bevel, there's a little hole here. It should always be up. Bevel should always be up. So this is where the gauge, the diameter of the needle would be. So the diameter, so this is talking about the length. And now let's talk about the diameter. The diameter is how thick, how the opening is. And like I said, we use bigger gauges for medications that are very viscous, very thick, and blood also. And then we use the small gauges for, depending if it's something quick, or babies, pediatric patients, probably. So the thing here is that the smaller the gauge number, the bigger the diameter will be. And the bigger the gauge number, the smaller the diameter will be. Okay, so they're kind of opposite. Here you have this chart where it tells you, different gauge needles, sizes. And then it's also giving you a picture, a visual of the diameter. And then what are their typical or their most common indication, okay? So we normally give the big ones, these large gauges, for when we're gonna give blood transfusions, or the moms in OB. When we have moms in OB, we always try to get an 18 gauge, just in case that we have to give blood, because the blood is real thick and you don't want the blood cells to die in the process of transfusion. So we try to aim for an 18 or a 19. And then we have the 21, 22, 23. This is more typical what we start on patients, the standard needle gauge for most patients, and also for injections, okay? Then we have the 25. These are really smaller. These are for subcutaneous injections. And then these are the most common ones for sub-Qs and also intradermals, okay? So as you can see, the bigger, the smaller, the bigger the number, the smaller the gauge, and the smaller the number, the bigger the diameter, okay? Any questions with that, you guys?
None.
None? That was pretty cool, huh? Pretty quick.
Yeah, that was.
Yeah, so that is pretty much the 3 chapters.
Jonathan?
And then I have a question, Ms. Bravo.
Sure.
This presentation that you just gave, the recording is going to be on the Canvas page in addition to the slides?
Yes, I just like I did it last week. It doesn't, I think in a couple of hours, I'm gonna get it. It's gonna, I guess, it's gonna send me an email to tell me that it's ready. It's ready, and then I'll just copy the link and then post the link to you guys. I don't know if you were able to see last week's presentation, but I posted it I posted it in 2 places. I think I put it in the announcements, and I also put it in under the module for week 2. You could see it. Like today, I'm gonna put it under week 2, where the chapter 6, 8, and 9 go. Okay, so you could find it in 2 places.
Okay, I see it now.
Yeah.
Thank you.
And if there is anything that you guys feel or you guys need, I just don't want you to feel disconnected with the class or feel that you are by yourself trying to deal with this, because it can be pretty challenging sometimes. So I do want you to reach out or tell me, I posted a lot of practice problems as well so that you can, work with them. If you get stuck in a problem next week, or let me know, maybe on Thursday, I can be an hour available on Thursday or 2 hours available so that we can talk about problems if you get stuck in any of the ones that I gave you for practice. Okay. And then remember, I didn't remove the drained. Don't disregard anything that comes with drain and grain, the drums. Those, we're not using those. That's all old practice. That's all. Okay. Do you have any other questions, you guys?